What is the first thing your doctor asks you once they confirm your pregnancy? Are you taking any folic acid supplements? Hello everyone, I'm Sylvia, or I am Mama, and today I'm going to be talking to you about folic acid, which in my view is probably the most important food supplement if you are pregnant or planning to get pregnant. Folic acid or folate are just another names for vitamin B9. Folate occurs naturally in foods, while folic acid is the synthetic version of this vitamin. Every cell in our body needs this vitamin for normal cell growth and development because it is important in making and repairing DNA, our genetic material. And it is especially needed during the rapid cell growth, such as in infancy, adolescence, and of course pregnancy. For example, the neural tube from which the brain and spinal cord develop begins to form about 3 weeks after conception. So it is super important that you start taking your folic acid supplements before you even know you're pregnant, and minimum throughout the first trimester of pregnancy. What's more, this vitamin B9 or folic acid works together with vitamin B12 to produce healthy red blood cells and prevent anemia. Also, it is very important for fertility in both men and women. Not enough folic acid can cause neural tube defects in developing baby in early pregnancy. These are abnormalities of central nervous system that affect baby's spine, skull, and the brain. The most common ones are Spina Bifida, which affects the spine, and Anencephaly, which affects the skull and the brain. In babies with Spina Bifida, the neural tube fails to develop or close properly, while Anencephaly is the absence of a major part of brain and skull. Babies born with this condition typically last only a few hours or days. Our bodies cannot produce this vitamin by themselves, so we need to get it from our diet or food supplements. The name folic acid or folate comes from Latin word folium, which means leaf. So guess where we can find them? You guessed it! Yes, it is the green leafy vegetables such as your lettuce, kale, spinach, broccoli, Brussels sprouts, also asparagus, avocado, beans or peas, some fruits such as bananas, melons, citrus fruits, but also other foods such as nuts, poultry, meat, fish, dairy and eggs. So you may think, well, I eat all of these foods anyway, so why do I need to take any supplements? Actually, the naturally occurring folates in food are not absorbed by our bodies as well as the synthetic version, the folic acid. So if you are pregnant or planning to get pregnant, definitely take your supplements as well. And how much should you take? Well, most prenatal vitamins will have a minimum recommended level of 400 micrograms of folic acid. I'm taking Pregnacare, but there's so many different other brands. And ideally, you should start taking this before you even know you're pregnant, so during the planning stages. Once you're confirmed pregnant, your doctor may prescribe you extra folic acid, and this could be anywhere from extra 400 micrograms on top of your prenatal vitamins to 5 milligrams or 5,000 micrograms in extreme cases. So always listen to your doctor. But since vitamin B9 or folic acid is a water-soluble vitamin, like all the other B and C vitamins, this means your body does not store it. So use it only as much as it needs, and the rest is flushed out from your body. So there is no real danger of overdosing, even if you take a little extra. And that's it from me for today. I hope you enjoyed my video on folic acid. My next video will be all about omega-3s and why are they so important in pregnancy. So stay tuned, subscribe, like and share, and thank you for watching. See you next time. Bye bye.